The date is August 18th, 2009, and that book was huge.
Think of it, just hoof and mouth disease, a thing of the past.
I wanted to shoot this video in the library because I know how much y'all like to know that I don't make this stuff up. And this type of question is not the type that I could answer from memory anyway. But the library closed before I could shoot the video, so I kind of have to do it here. So this question I received on my universal healthcare video from a YouTuber named Wizzall, who asked this question: are psychotropic drugs truly a healthy option to offer people? He goes on to highlight specific issues, such as jumping straight to medication without a treatment plan, and that sometimes doctors don't know what they're talking about when it comes to behavioral treatment. They wouldn't be the first. I really appreciate this question because behavioral health is usually not something that's included on discussions on health as a whole, which is strange because it actually seems pretty important. So pay attention. It's important to cover a few psychiatry basics. The word psychotropic, when you break it down, means mind-turning when you reduce it to Greek. Mind-bending, if you like. An alternative name for these drugs is psychoactive, which is a lot more commonly used, and no disrespect, but I prefer psychoactive, so that's the term I'm going to be using. It just seems a little bit more accurate to me. Whatever. Psychoactive drugs, if you haven't guessed by now, are active in the mind. Some relate to moods, while others can quite profoundly change one's perception of reality. They come in both legal and illegal varieties, but for the sake of our discussion, they come in four main types. We've got anti-anxiety, like Xanax, antidepressants, like Zoloft, antipsychotics, like Clozaril, and mood stabilizers or anti-bipolar drugs, like lithium and other drugs based on lithium. Now, most of the time, these drugs are pretty effective at containing or controlling symptoms. And notice I said symptoms. Drugs are not, I repeat, not a cure for mental illness, period. The book that I was reading, and I'll cite it over there, says it very well. Medications function best to alleviate symptoms. Psychotherapy, in contrast, functions best to resolve specific issues. An analogy: your dog takes a dump on the sofa. Which problem do you solve first? Would it be the problem of your dog's infuriating insolence? Or do you clean up the massive turd that's stinking up your sofa? So drugs do a good job of pushing life-altering symptoms out of the way so that a therapist can help resolve underlying causes. These drugs, by standard, may only be prescribed by someone with an MD or a DO behind their name, which means that one must go through the pain and torment of med school. No regular psychologist need apply. Sorry guys. So psychiatrists may prescribe medications, but also family docs too. Hypothetically, your gastroenterologist could prescribe you a psychoactive drug. Not saying they would, just saying they could. Because as politicians, doctors, and other old white guys of decades past have concluded, only MDs and DOs have the basic knowledge of body chemistry and physiology to determine if a drug is going to harm or kill somebody. Which is a fair assessment, I think. But the unfair part of this is that the person who usually understands the behavioral and psychological needs of a patient can't do anything without a doctor's permission, which I'm sure could be bypassed by a simple note. Hey, this guy needs Xanax. But the doctor has every right and ability under law to veto the heck out of that note and probably rip it up too, so he doesn't get sued later when things go south. That's a different video. There is a remedy, however controversial, where there are programs in certain states where a psychologist can undergo training to prescribe medication, which can be a huge help in treatment. But some of the biggest opponents of this are other psychologists who wish to preserve the purity and integrity of the discipline by keeping medication solely out of the way. I'll let you decide where to stand on that. There are a bunch of links over in that sidebar there for things that I've cited and other sites that I've mentioned if you want to do a little bit of research yourself. Until next week, I'm waiting for your questions and your comments. Peace.